Hi, my name's Sammy Kadak, and I'm a women's pelvic health physiotherapist, and I also fit pessaries to help with prolapse and stress incontinence. So today I'm going to walk you through how to use your ring pessary, which is really helpful for supporting the front wall of the vagina and the top of the vagina, so the uterus and the cervix. And this also just happens to be the type of pessary that I use, and I love it. So the nice thing about pessaries is that when they're in a good position, you shouldn't feel them at all. So kind of like a tampon, when it's in the right place, you don't notice it once you put it in. A couple of my tips and tricks for using a ring pessary is to look at where the notches are. So on this one, we have, this is called a ring with support. So it does have this membrane in the middle. Some of the ring pessaries won't have that membrane. They can still both be really effective. But there are usually two little notches in the ring of the pessary, which allows it to fold quite well at those points. It won't fold as well in the other direction. So if you, when you're going to insert it, you want to fold it, and then also being able to have those holes, those bigger holes toward the entrance of the vagina, it means that it's a little easier to remove as well, compared to if the hole's off to the side and you're trying to grab it from here. So you're going to fold the pessary first. I think of keeping the pessary, when you're folding it, in a rainbow shape as opposed to a boat or a smiley face. So if you are right-handed, you're going to hold the pessary down towards the end, maintaining that rainbow shape with an overhand grip. This is the vagina. You're going to gently rest the pessary at the entrance of the vagina and then angle it in and downwards, more towards the tailbone or towards the back of the pelvis. And that helps to get it resting behind the cervix as opposed to coming to touch the end of the cervix or sitting in front. Often if it's sitting in front or at the cervix, it will feel like there's a little bit more of a deep pressure, potentially a bit less comfortable. So do try to get it in and down below the cervix. And that's why that rainbow shape is really helpful. If you're inserting it this way, you're more likely to get it in front or touching the cervix. If you do happen to feel that deep oof of contact with the cervix, then the best thing to do is just to take it out and try again. So the other tip with insertion is that, so the other tip with insertion is that if you are using some lubricant on the pessary, just put it around the top edge, not down where you're holding. I've learned the hard way that if it's really slippery down here and you're trying to squeeze it at the same time, bling, it's literally going to fly across the room because it's too slippery and there is a bit of recoil to the material. So just a little bit of lubricant around the top if you need it. Some people find that their vagina just has a bit more of that natural lubricant and they don't need any extra added. When inserting the pessary, some of my ladies prefer to be lying down, and that can help the pelvic floor be more relaxed because it's not working against gravity. It can also allow the prolapse, if it had been sitting a lot lower, then when you're lying down, things tend to be reduced. So things are sitting up a little higher and you're not having to kind of scoop and push any bulge back in as you're inserting the pessary. But some of my ladies prefer to do it standing. They just have a little bit more reach and leverage in that position. So it really comes down to personal preference. In terms of removing the pessary, you do want to go inside the vagina and find that larger hole to be able to hook your finger through. So while you were able to fold the pessary to insert it, you can't really fold it to bring it back out. If you're finding that it just feels a little bit too wide and a bit uncomfortable coming out, one thing that I actually do is I'll bring it down a bit with my finger, and then I'll intentionally do a Kegel. So I'll squeeze my pelvic floor just to help it fold a little bit, and then pull it down through that more switched on pelvic floor. Yes, it does feel like there's a little bit more pressure on the muscles, but the skin for me, and what I've seen for some of my patients as well, is that it just feels less stretchy and less pressure overall. So that could be something to try. Some people find that just keeping everything as relaxed as possible as they take the pessary out tends to be the best way to do it for them. So I hope that's been helpful. I think ring pessaries can be such a fabulous support and give you a lot of relief. And if you have any questions, please let me know below.